Okay, guys, I have discussion B for you. Now, B's discussion, we're discussing the other side of marijuana use for medical use. Okay, so the bad effects it has on your heart and such. So here we go with B for you. Let me back up just a hair. Okay. Headline reads: Heart risks linked to marijuana use. A meta-analysis across 24 studies, nearly 200 million people from 6 countries, found that marijuana users face a significantly elevated risk of cardiovascular events, notably heart attacks and stroke. Edibles not necessarily safer. The article warns that even non-smoking methods of cannabis consumption, like edibles, may pose similar heart risk, similar heart health risks. Usage trends in public health implications. Widespread use. As of 2021, over 52 million Americans used marijuana, and nearly 3 in 10 users have a cannabis use disorder. Early users before age 18 is a notable risk factor. Youth vaping concerns related findings from the National Youth Tobacco Survey highlight a sharp rise in adolescent vaping of THC and CBD and synthetic cannabinoids between 2021 and 2023. Many teens are unaware of what substances they're inhaling. Expert insights. Researchers call for better public health policies to address both marijuana related heart risks and the growing trend of in teen substance vaping. If you'd like, I can help you explore the findings or how they might relate to smart health tech and cardiovascular monitoring in elder care settings. The long-term effects of marijuana on the heart health are increasingly coming into focus, and they're more serious than many people realize. Here's a breakdown of what the research shows. Cardiovascular risks, increased heart rate and blood pressure. THC, the psychoactive compound in marijuana, can cause the heart to beat faster and raise blood pressure immediately after use. Higher risks of heart of higher risks of heart attack and stroke. Regular marijuana use has been linked to a significantly elevated risk of heart attack, stroke, and heart failure, even after adjusting for other risk factors like diabetes and high cholesterol. Arterial sclerosis and inflammation. THC promotes inflammation in the blood vessels and accelerates plaque buildup, arteriosclerosis, which can lead to cardiovascular events, brain and vascular effects, stroke risks. Studies suggest marijuana use may increase the likelihood of ischemic stroke, especially in younger users. Arrhythmias. There's evidence connecting marijuana use to arterial fibrillation, a heart rhythm disorder that can lead to stroke or heart failure. Mechanisms and interactions. Cannabinoids receptors in the heart. THC binds to CB1 receptors found on heart cells and platelets. Potentially disrupting cardiovascular function. Drug interactions. Marijuana may interfere with medications for blood pressure, cholesterol, and heart rhythm disorders. Older adults and vulnerable populations, elevated risk in seniors. Older adults with conditions like high blood pressure or diabetes who use marijuana have a significantly increased risk of major heart or brain events while hospitalized. Early use matters. Starting marijuana use before age 18 is associated with higher lifetime cardiovascular risk. If you're curious, I can also walk you through how these findings intersect with smart health monitoring, frailty aware care, or even ethical considerations in cannabis policy. Want to explore one of those angles? Absolutely. THC, the primary psychoactive compound in cannabis, has a direct impact on heart rate through several physiological mechanisms. Nervous system activation, sympathetic nervous system stimulation. THC elevates the fight or flight response, increasing the release of Uh, Ketamines like uh, ad, adrenaline result. This leads to rapid increase in heart rate, often by 20 to 50% above baseline, and can last for several hours. Cardiovascular or vascular effects. Uh, Vascularization. THC causes blood vessels to widen, which can lower blood pressure. Com- compensation, compensatory tachycardia. To maintain adequate blood flow, the heart compensates by beating faster. Ecocannabinoid system interaction. CB1 receptors on heart cells. THC binds with cannabinoid receptors in the heart and vascular tissue, altering autonomic regulation. Impact. This can disrupt normal rhythm and increase susceptibility to arrhythmias. Hormonal influence. Okay, elevated uh, ketamines. THC increases circulating stress hormones, which further elevate heart rate and oxygen demand. Risk amplification in vulnerable populations. Older adults and those with heart conditions. The increased heart rate can exacerbate underlying cardiovascular tissues, raising the risk of heart attack or stroke. If you're interested, I can walk you through how CBD modulates these effects, or how THC cardiovascular impact might intersect with frailty aware care models and smart monitoring systems. Want to delve deeper into one of those? Great question. CBD and THC have a fascinating interplay when it comes to heart rate and is not a it's not a matter of one canceling the other out. How they interact. Counterbalancing effects. THC elevates heart rate. THC stimulates the sympathetic nervous system, leading to increased heart rate and oxygen demand. This can result in tachycardia and, in some cases, arrhythmias. CBD modulates THC impact. CBD can alternate the heart racing effects of THC by blocking THC action in CB1 receptors, which are abundant in heart and vascular tissues. Okay, guys, so that is B for you. I will see everybody in a few minutes for C. Give me a few for C, please, and I'll be back on with you shortly. For now, Gator Wellness, take care, folks. I'll be back on shortly.